Hello again. Wow, you guys are gunners. So it never fails. We always have parasitology right before lunch. But at least now we're moving on to other things. So common blood-borne parasites. So again, if you were just here with me for the past hour, this is very similar to what we did with the intestinal parasites, but now we're going to do blood-borne parasites. So we're going to review those that are common, what their importance is, life cycles and transmission, what diagnostic tests can be done in a shelter setting, and treatments. So the plan is to do these, to talk about which are the common parasites of dogs and cats that are blood-borne, why they're common, why do we treat them, how do we diagnose them, and how do we prevent transmission in a shelter environment. So the key to blood-borne transmission are vectors. They require arthropods that are biting and transmitting these diseases. Some of them may also be transmitted through fighting or through transfusion. So, which are blood-borne parasites? Heartworm. Lyme, yeah, but this is me sidestepping that one because it's not a parasite. So, heartworm was what I definitely was like, well, duh, heartworm. And then I was like, what else do I give? Trypanosoma cruzi, that's on my slides too, yeah. Sorry? Ooh, cytoxoan felis is a good one. That one's in cats. Did you have one more? Would it include FELV and those things? No. So not by, right. So I didn't start with my definition of parasite, right? But I'm excluding viruses and bacteria. I'm only talking about those animals that live in animals. So cytoxoan felis is a really important blood-borne parasite of cats. It's common in some areas of the country, but not others, so it didn't make it onto my slide list. I probably should have, since Babesia is up here. But these were the three that I came up with. Heartworm, Babesia, trypanosomes. So Trypanosoma cruzi, which is the cause of Chagas disease. So why are these common? Well, you can get really large numbers of organisms in the blood. For heartworm, the little worms, the baby worms, which are called microfilariae, we can have typically about 4,000 to 2,000 per ml of blood. And that can be up to 100,000. So these things are really numerous in animals. They're transmitted through biting arthropods, and they can use many different types of mammalian hosts as hosts to be present in the environment. And now we have resistance in heartworm. So I'm going to try and hit you over the head with that one because this is important and horrifying. So Babesia and Trypanosoma. Babesia is a blood parasite, mainly in dogs. There's no cases reported in cats. So I had gone through and I was kind of photoshopping out the cat from there, but then I decided I'll just leave it in because it is possible in other areas. It's a tick-transmitted disease. Transmission is either by that tick bite. It has been shown to be transmitted transplacentally. Also, fighting can transmit the infection, and transfusion. And then disease is considered to be uncommon in animals that are infected and healthy unless they have been splenectomized. So if their spleen has been removed, then they do not do well at all. The disease itself is going to be hemolytic anemia, and what that means is the red blood cells are being ruptured by the parasite and leading to anemia in that way. Signs include fever, anorexia, depression, pallor, which just means they're pale due to loss of blood, splenomegaly, which is an enlargement of the spleen because it's trying to produce more red blood cells, and then a bounding pulse, so just really heavy pulses. Trypanosomes, that's Trypanosoma cruzi, is the one that's in the Americas, which leads to Chagas disease. It's more severe in animals that are less than 6 months old, and if animals are diagnosed with this infection as a young animal, then the prognosis is poorer. So it's expected they won't do very well. Acute disease can happen after the first 30 days, and then clinical signs can include lethargy, organomegaly, so organs that get really large like the spleen or the liver. Sudden death due to cardiac insufficiency is usually what this is going to end up as. This is kind of a characteristic picture. This is actually a human heart, but this is what our expectations are for individuals that are infected with Chagas. It's a chronic disease, so after 8 months post-infection, that's when you enter the chronic infection stage, and you start to actually see disease associated with this. And it's going to be associated with the myocarditis and dilation of the heart. So you can see the wall of the heart has become really, really thin and very fibrotic. And so death occurs due to cardiac complications. It's really common in shelters and kennels, especially in the South. It's been reported in up to 8% of dogs that were tested in a kennel in a shelter in Texas, in shelters in Texas. And in Texas, this is for pet dogs, but there's an uptick in the number of pacemakers that are going into dogs to try and help them make it through their infection. So you can imagine that's quite expensive. So obviously pet dogs, not a choice for shelter dogs. But after I went through this, I started thinking about it, and I was like, well, the question or the mandate, so to speak, of what was asked of me was to talk about common ones that you would diagnose in a shelter. And you're very unlikely to be diagnosing Babesia and trypanosomes because you're going to be diagnosing those on stained blood smears or serology or by molecular means. So you're probably not going to be doing that in the shelter. You might be sending it out. And because the prognosis is not good, you're probably not going to be spending much time or effort, unfortunately, treating these animals. Treatment for Babesia can resolve the symptoms associated with it, but you're not going to clear the infection, and so they can have disease later on. And there is no treatment for trypanosoma in the US. You can't get it. So it's usually a disease or an infection that leads to euthanasia. So animals are unlikely to be adoptable if they have these parasites. Therefore, that's as much as I was going to cover them with you. And probably cytoxine would fall within these same things. Now, dogs that have Babesia and have trypanosoma might come into the shelter, and then you have to prevent transmission by making sure that ticks aren't present and making sure that they're not fighting. Probably the most practical thing with respect to transmission of these would be to try and prevent fighting amongst dogs. That's exactly what I told you, so I'm doing well. Okay, so we're going to focus on heartworm from here on out. And my left ear has decided to stop working, so I'm echoing in my own ear. But I'm going to try and hear you as you yell out to me some facts you remember about heartworm.
Hard to treat.
One more time. Hard to treat, yes. Well, depends, but yeah, usually. Vector by mosquitoes, good. Anything else? Easy to test for? Yeah, we have a pretty simple test.
Tests only detect female infections?
Ooh, that's a good one. Tests only detect female infections. That's true. How long before we can test an animal?
6 months.
Well, you guys, why am I even here? 6 months, yes, that's right. Can cats get infected?
Yes.
Is it hard to test cats? Hard to detect and sometimes hard to treat cats. Okay, right. So you guys have a good basis. That's exactly what you're going to be hearing from me. So first thing is life cycle. So you have to have a mosquito that comes along and puts an infective larva on the skin of the dog. When the mosquito moves its proboscis after feeding, the little larva hops into the skin, and it's going to stay in subcutaneous tissues for about 50 days or so. Eventually, it makes its way to the pulmonary vessels and will start to grow up into adulthood. At about 5 to 6 months, they start to make babies, right? So boy meets girl, they have sex, they make these babies that are known as microfilariae, and then microfilariae are in the blood and circulate. And then when the mosquito comes along, bites that animal, goes off, that little microfilariae will develop through a first, second, and third stage larva. How long does it take for that baby to grow up to an infective larva in the mosquito? I have a guess for 45 days, and maybe if it's really cold. So the fastest, I should have said, what's the fastest? So the fastest is 2 weeks. It takes 2 weeks for that little larva to get to the infective stage. Now, clearly, if you're in an area where dogs, coyotes, and other canids are infected and mosquitoes are constantly feeding on them, then there's going to already be some infective ones in there. But that's just to say, let's say you have a dog that has heartworm and you've moved to the Arctic and you bring it with you. Probably not going to be a mosquito there, but let's just say you brought a mosquito with you and it fed on that dog. It's not going to transmit it to anybody else, couldn't transmit it to anybody else until 2 weeks later. That was a horrible example. I could get fired for that. Anyway, disease is going to be cardiopulmonary disease in dogs and pulmonary disease in cats. Transmission by mosquitoes, as you guys said. Also transfusion. So if you take 50 microfilari from dog number 1 and you transfuse it into dog number 2, how many adults do you get in dog number 2? Choices: 0, 5, 10, 50. We have a vote for 50. Do we want to second her? But you guys told me it has to go through mosquitoes. It has to go through mosquitoes, right? So you get 50 microfilari in dog 2 because you put them there, but you don't get any adults until that dog gets bitten by a mosquito that has larvae. So when we treat dogs, you need to consider treating the adults, treating any L3s, so the new ones that got dropped off by the mosquito, so that they don't grow up to adulthood. You have to, let me start over, 3 populations. You're going to treat the new infections that got dropped off by mosquitoes such that they don't develop to adults. You need to remove the adults because they're banging up against the wall of the vessel every time the heart thumps and they're causing inflammation. And you need to remove the microfilari, not because they might grow up to adulthood, but because if that dog has microfilari, it is a source of infection for dogs around it. Does that make sense? So that's a little L3 that's wiggling around. That's the infective one that's coming out of the mosquito after it developed there for about 2 weeks. Doesn't look like too much, but it grows up to be a foot long. As my boss, Dr. Bowman, always says, folks, they're a foot long. So they're really big once they're in that in the pulmonary vessels. Prevalence in dogs and cats is going to vary geographically, but it does continue to increase throughout. We used to have this thing where we wouldn't, put the dog on a preventative for heartworm disease for 6 months, and then you can take them off for 6 months. Don't do that. You're going to get infected dogs. Put them on a preventative for heartworm disease that covers roundworms and hookworms and keep it on that year-round for the rest of their life. So what I'm saying is cats and dogs dewormed every month for the rest of their lives. That's because they're a bag of worms, and we got to make sure they're in our beds. They have to be as parasite-free as possible. So mosquito ranges are expanding. We're starting to get more warming and environments that are conducive to development of mosquitoes, and we are moving dogs around a lot too. So if we didn't have dogs that were infected before, we do now. The prevalence in pet dogs, yeah, I was thinking about it backwards. Anyway, prevalence in pet dogs is lower, as you might imagine, than that in shelter dogs, and that's just because shelter dogs very commonly haven't gotten the preventives that are keeping them from getting adult worms. But even in pet dogs, 5 out of every 400 dogs that's seeing veterinarians and getting veterinary care has adult worms. So that's pretty shocking. That's a lot of dogs. Cats can also be infected, as you guys already know and you told me. They're more likely to have juvenile worms, and it's estimated that they actually have about as many juvenile worms as dogs do. Adult heartworm infection, though, is about 10% that of well cared for dogs, or sometimes even shelter dogs, depending on the area and whether cats are allowed to roam or not. Greatest number of cases, as you might expect from that, right? If we know that heartworm prevalence is highest there for dogs, you would expect that that's where it's highest for cats as well. And that is indeed what we're seeing. In a couple of studies looking into the prevalence in cats, out of 2,000 cats, 12% of them had antibodies. What that's telling us is not that they necessarily had adult worms, but they've been infected and exposed to the parasite in the past. And when they tested nationwide 25,000, almost 16% had antibodies for it. So our cats are also getting exposed a lot. This is prevalence by antibody on the right and by antigen on the left. And so it's redder on the right because that's telling you that you've had exposure, right? We've already kind of alluded to how hard it is sometimes to test in cats because you require female worms. Cats typically don't have a heck of a lot of worms. They're more likely to have adult male infections. Therefore, you may not be able to detect it by an antigen test. That doesn't mean they're not infected. It just means they don't have a lot of adult females. And so this is by testing by necropsy for cats from 1939 to 2004. And you can see prevalences do bounce around, but they are pretty high in some areas, 14%, 10%, et cetera. So I think hopefully you've heard me loud and clear. Cats also get heartworm, which you told me to begin with, so you already knew. So why do we treat? Do we even need to treat? And what do we use? Why do we treat? It can kill animals, right? We want to treat the infections such that they don't have disease, and we want to prevent other animals from becoming infected. So we need to make sure that there's no reservoirs in the environment that that mosquitoes can feed on and transmit the parasite to other animals. And we need to ensure that people don't get infected. So this is also a zoonotic agent. Most of us don't have any clinical signs, and oftentimes we don't even know that that's there, but it is a possibility, and the biggest issue is just that it can look like a tumor when we look at it on x-ray, and I'll come back to that later. So my pictures moved around a little bit, sorry. So disease is going to vary from no disease at all to death. You get multiple system dysfunction, and that's associated with pulmonary hypertension. So these worms are in those vessels. As I said, they're banging around. I don't know if you can see it all the way from the back, but this vessel should be nice and smooth, and there's all these little white dots. This is my visual for you guys. There's little fingers coming out from the wall of the vessel, and so when the blood's going by, that's going to produce further inflammation, and it's going to make it hard for the blood to move. So it's the difference between having water going through a nice smooth hose and having water that you have lined that hose with shag carpet. The thickening of that the wall of the vessel is going to continue while those worms are there. And you can get chunks of worm or chunks like blood clots that can then be produced and plug up vessels down the line. Rarely you can have ectopic infections. What that means is they're not in the place where they're quote unquote supposed to be. So sometimes heartworms show up in the eye, CNS, peritoneal cavity, or in the skin. And sometimes they can lead to this thing known as CAVA syndrome. So this is rare, but typically involves animals that have very, very large numbers of adults in the pulmonary arteries, and they start to interfere with the valve function in the heart. It's a life-threatening condition that can be associated with hemolytic anemia, again, the bursting of blood cells, and eventually right-sided heart failure associated with, again, paleness, weak pulses, tachycardia, so really fast heartbeat and sudden collapse. They can get DIC, and also you can see blood in the urine. So that's with the adults. The microfilariae are thought to maybe have an antigen-antibody complex that can accumulate in the kidneys and affect the kidneys. That hasn't been really well established, but it's something that people do consider. And then you can also have localized damage maybe when the microfilariae die. Clinical signs for heartworm disease include cough, dyspnea, weight loss. You can get accumulation of fluid in the peritoneal cavity, exercise intolerance, and arrhythmias. So this is a pulmonary artery, and you can see the worm occluding part of it. There's a little bit of space for the blood to go through, and all of this pink stuff here, that's all the thickening that has happened. So the blood vessel's starting to constrict, get smaller and smaller and smaller, and there's not going to be a heck of a lot of blood going through that. These are the worms, and it has the maybe you can see it now, it has that shag carpet kind of appearance there. That one's more obvious. I think you'll buy it on that one. And then this is just showing us those worms bouncing around up and down. And this is a surgery for caval syndrome, so they're going in through the jugular vein. Oh yeah, I'm supposed to say if you're squeamish, look away. So they go in, and very, very carefully, they're going to start to pull out the worms. And they're doing this because this is the only chance for this dog to survive. Foot long, guys. They just keep coming. It is like spaghetti, literally. About that thickness. That'll give you the thin spaghetti, right? So, angel hair pasta. Oh yeah, lunch is coming up. Sorry. I should just stop now. So heartworm-associated respiratory disease, or HARD, is the disease that's often associated with heartworm in cats. And so what's happening is that you're having consolidation, or all the air spaces in the lungs start to get clogged up with inflammatory cells, which are a result of the dying worms that are getting in there. And you get a presentation. You can have cats that are look more like they have bronchitis or maybe asthma. It's more about, a coughing, dyspnea, wheezing. So in terms of those cats that have adult infections, the breakdown of the clinical signs that they might have includes most of them had dyspnea, some have coughing, a good third of them are asymptomatic. Vomiting seems to be a fairly common sign. Some had neurosigns, and some were dead on arrival. So 10%. It's pretty high. So 10 to 20% of diagnosed cases of cats that have heartworms have sudden death, and we don't really know why, but it's thought that maybe it has something similar to acute respiratory distress syndrome, and that there's antigens that are released by the worms. As I mentioned, vomiting is something that's common, and you can have clots that can start to occlude the vessels. Ectopic infections are more common in cats than they are in dogs as well, so they can go to the brain, the eye, or the spinal cord. So some pictures to prove to you what you already know, that cats can get infected. Here's a single worm in the cat. There's more, so they don't always have single worm infections. This is occlusion of the pulmonary artery, similar to what we saw in the dog, and this you would expect to be seeing with the adult worms. But we can also see that in the alveoli. So the air pockets in the lungs, as I was saying, they can start to get occluded, in addition to the arteries themselves starting to get thickened and clogged up. This is the cat on presentation, so dead on arrival, and there is the worm threaded through the brain. I know it's not moving, but imagine it was. That'd be horrible. Just to give you an extra shock. Sorry, I can't help that stuff. So I mentioned they were zoonotic. What happens is we're not a great host for heartworm. And so they get to where they're quote unquote supposed to be, right? So they're heartworms, they're supposed to go to the pulmonary vessels, and they head that way, and they're like, oh no, I'm not in the right host, I don't think I feel so good, and then they die, and then our body walls them off. So they'll get what's known as a granuloma, just a whole bunch of cells contained or trying to contain that infection, which is just a dead worm. So you have what's known as a coin lesion in the lungs. That's the characteristic presentation. The problem is when a doctor sees that on an x-ray film, they're going to say, that kind of looks like it could be cancer. We got to go in there and take it out, and let's make sure it's not. So there's not a quick serologic test. You can't just do a blood test for this. You're not going to just say, it's probably heartworm, right? They're going to be like, let's make sure it's not cancer. So it's pretty invasive and costly diagnostics. And there's been about 100 cases that have been reported, but these are incidental findings, meaning people aren't symptomatic. They just happen to be tested for something else, and they notice the infection. So we don't really know how many of us are infected. We're definitely more likely to be infected if we're in areas where there's high prevalence in coyotes. There's going to be high prevalence in dogs in that area. There's going to be some prevalence of cats in that area. And when cats start to get infected, they're kind of a good, we call them sentinels for human infection. So if cats are infected, those are areas where the prevalence is high enough, we might start to see it in people. Okay, so treatment and prevention. We said treatment can be hard. It didn't used to be hard. It used to be simple if what we were talking about was treatment of L3, L4s. So we call these things preventatives, right? Because they are preventatives for heartworm infection, but they're all treatments. They're just killing worms. It's just we were killing immature worms. We were killing the third or fourth stage larva prior to their developing into adult worms, because it's the adults that cause disease in dogs. So when we're giving them their monthly, we're just killing any worms that they've acquired from mosquitoes the month prior to that. But now it's getting harder, because now we have resistance, and so there's some groups of heartworm out there that they're not going to die even if we're using the right drugs, or the drugs that used to be the right drugs. If we use them month after month after month, we're still very likely to kill them, but they're hardier. There's still a possibility that you can have a dog that is on monthly preventive all of its life and still get some worms because some of these groups of heartworms are resistant. Adult infections are tough. Adult infections, so generally for other parasites, it's the adults that are easiest to kill. Heartworm, it's the opposite. So now we have these adults. They're on the pulmonary vessels, and we have to kill them with an arsenical compound. You are not going to kill them well with the preventatives. So this is another one that I'm going to harp on you about in a second. So melarsamine is what has to be used for adult infections, unless you want to go in and remove them surgically, which doesn't seem very practical, but my understanding is in Florida in the past, there were some clinics that were doing those surgeries very efficiently and very quickly. But probably not the way to go for shelters, right? And then microfilariae are the other group of parasites, the other stage of the parasite that you're going to need to remove, because you need to ensure that there's none left over to infect other animals. And Advantage Multi is the only thing that is labeled for that, which is moxidectin. And uninfected dogs, you need to keep them from getting infected, so they need to be on prevention year-round. And yes, I said there's resistance, but it's better to have less worms than more worms. So you have dogs that are susceptible, which is any dog or any cat. They're going to get worms if they get bitten by mosquitoes that have heartworm. They may not get worms if they have a preventive on board, especially unlikely in certain areas that we still don't have a lot of resistance in. And here is my depiction of how I feel talking to you guys, because I have the answers, I can tell you what to do, but you put it in a shelter setting and it's difficult, right? So you need to remove the microfilariae, which means you need to treat with advantage multi. That's what it says by law. You need to keep them from getting infected, so you need to do monthly prevention. And if there's adult infections, you need to kill them with malarsamine. But that's money. And the malarsamine treatment for adulticidal therapy means you're going to be keeping those dogs for a lot longer, and you need to get them out the door. So they're not the right answers for you. I know that, but at the same time, I'm not sure what else to tell you. That's what we need to do. There's some tweaking that can happen, but not a heck of a lot. Treatment in cats, and we'll come back to that thought in a second. So treatment in cats, you need to make sure that you're removing those newly acquired infections, so the L3s and L4s, by giving them monthly treatments. Removal of adult worms. You can't use miticide. Malarsamine is not recommended for cats, so you're not going to do adulticidal therapy in them. So essentially, you're just going to put them on a preventative and wait out the worms. Surgical removal has been done in pet cats, but that's a whole other quote-unquote can of worms, right? It has a lot of complications and issues. It's problematic. And microfilaricidal therapy is not indicated because they don't have a heck of a lot of worms, adult worms. They're not going to have a heck of a lot of microfilariae. So cats are considered a dead-end host because they're not going to be able to propagate that life cycle. For those cats that are symptomatic, you're going to treat the symptoms because you can't remove the adults unless you're going to surgically remove them. So you just treat the symptoms, make sure that they can breathe, and then take it from there. The prognosis is actually pretty good. So the reports for life expectancy after you determine that cats have adults is about 1.5 years. Cats that survive acute disease, median of 4 years survival, but it seems like over 80% of cats that are diagnosed with heartworm are expected to survive their infection. So there's fairly good prognosis even though they might be infected. Which brings us to diagnosis. You can do parasitological diagnosis, so actually try and find the worms themselves, and you're going to do that in a blood smear. Remember that there's two kinds of microfilariae out there for those of you that might be doing this. There's this other thing, which is Acanthocalanema reconditum, and do you care that that's what it's called? No, you just have to know that's this other thing that's out there that you don't have to worry about. It's non-pathogenic, it's skinnier and longer, and if you need to know, you just call a friend, right? Phone a friend and make sure that it's somebody that can help you tell the difference. But just FYI, if all you're going by is microfilariae, it may not be heartworm. So blood smears can help you find the microfilariae if they're present. We do know that there's sometimes even up to 20% of dogs that may not have any circulating microfilariae, so don't rely on that alone. And you can concentrate the microfilariae either with a filter or with centrifugation. And then we have, as you guys said, the pretty easy version, or at least when you say it's easy to detect, I think, SNAP test, right? So you can detect antibodies. That's probably more useful in cats than dogs, because antibodies in dogs, again, it's just going to tell you exposure, but if you have had them treated in the past, you may have antibodies and no worms. Antigen is going to tell you that you have adult worms. Okay, so antigen tells you you have or have had adult worms within the past 4 months, 4 to 6 months. That's to say you can have dead worms and still have antigen circulating for 4 to 6 months after they died. So you shouldn't test a dog after you treat them with adulticidal therapy right away because the antigen test is going to stay positive. You need to be a little bit careful not to start pooling blood because you can have interference, and that there may be antibodies in one sample that can block the antigen, so it globs up the antigen and it can sequester it from the test, so you'll have a negative test even though you have antigen there. And also, if you have had a dog that has been treated with macrocyclic lactones, those are things like ivermectin, moxidectin, selamectin, any of the preventative products, you can also have a potential for blocking. So you might have negative antigen tests, again, in dogs that are actually positive. You can break those complexes, the antigen-antibody complexes, by heating the sera. So that's one more step that can be taken to ensure that you're getting a better chance of really detecting the antigen. But you don't want to do that on all your sera, obviously, because if you're looking for antibodies for anything else, that's going to denature them and make them all sloppy and unrecognizable by the tests. So why do we test by antigen testing? Is it bad for the dogs to give them? Are we going to kill a dog by giving it product if it's got heartworms already? I have votes for no and votes for yes. So I'll tell you what often is said to me. There's two answers that I often get. So no is right, but the two answers that I often get, which makes me think there's some misperceptions out there, is one, that you're going to kill the dog because you can kill all of the microfilariae all at once and they'll go into anaphylactic shock. And that's not very likely to happen. We all know it's not impossible for these things to happen. Animals are individuals. You give them a drug, they may not react well to it, and it's good to know that. But any of the drugs that are labeled to kill heartworms and heartworm microfilariae, i.e. moxidectin, but the others too, have been tested in dogs that have heartworm infections and are safe to be given to those dogs. The other question, or the other answer I sometimes get is, we're going to kill off a whole bunch of adults. But I just told you, adults are really hard to get rid of, and you have to use arsenical compounds to get rid of them. So it's not very likely you're going to kill off a whole bunch of adults, and that's the problem. Because you have to kill the adults with something else, you need to know whether they're already there or not. Okay, so we test for antigen because you need to identify those dogs that have adult infections such that you can kill those adults. The preventative products are not effective against adults. Adults are long-lived. They can live for, do you guys know how long adults live in a dog? 7 years. Yeah, 3 to 5 years is closer to what they live in cats, and then 5 to 7 is what they live in dogs. And you can select for resistance. And I'll come back to that. So if you take a dog that has adult worms and you put it on a preventive product and you don't do anything else to remove the adults, that's what's known as slow kill. And I am here to tell you, and you may have heard this already, but I'm going to say it again anyway, slow kill is bad. Slow kill is bad because of two things. Slow kill is slow, so some people argue that the preventives do have some effect on worms, but on adult worms. But what their basis for saying that is that it reduces their lifespan to 2 to 3 years instead of 5 to 7. Yes, it's a reduction of lifespan, but what you're saying to me is, I'm coming to you with my dog has a heartworm infection, he's got worms this big in his pulmonary arteries, and you're saying, just give this to him every month. They'll die in 2 to 3 years. It'll be fine. So I don't think that's a treatment, right? So bottom line is that is not an inconsequential decision to make, because if you leave those worms in that dog, and that dog is a happy-go-lucky dog and he's running around, they're going to go thump, thump, thump against the wall of the artery every time that heart beats, right? And so you're going to get progression of disease in that dog. You also have worms that are making microfilariae every single day, and you're showing them teeny tiny little bits of drug, and you're killing the ones that you can, and the ones that are hardier get left behind, which is where the selection for resistance happens. And I told you, right, if you guys remember, there can be up to 100,000 microfilariae per ml of blood, so that means there's a really good chance that some of those are going to be hardier. So we need to make sure we're using our products the way that they were supposed to be used, and unfortunately, we're past the point of having no resistance where I could say, or we'd get resistance. We're past that. We have resistance now. The other reason this isn't inconsequential and you guys should care is because if you select for a resistant strain in a dog in your area and you live near there, now you've got it in mosquitoes in your area, and it can bite your dog, And even if your dog is on a preventive, if that worm is resistant, your dog is going to get a worm too. So we need to make sure we're knocking down as many of these worms as possible. So the question is whether or not that was an acceptable treatment, whether she has a misperception that it was acceptable at one point. It was perceived by some to be an acceptable choice, even though others were like, as you said, it's a bad idea, we're going to end up with resistance. The reason people thought it was an okay choice was because they thought, well, if you give a miticide, you're going to kill all of melarsamine, you're going to kill all of these adult worms, and so you have like a large proportion of the adults dying. The dog is more likely to have a poorer prognosis in that scenario. If you do slow kill, they'll just die slowly over time. They said, oh, we're not going to get resistance. There's so many dogs out there that are infected. There's very likely to be a dilution effect, so to speak, of resistant worms. We're never going to see resistance to these products. And obviously, those people were wrong. We do have resistance now. And those dogs still had the worms, still had the progression of the disease. Those worms still die. So the other thing my boss has a tendency to say, which I think is a good thing to consider, is we kill adult roundworms and hookworms, tapeworms. They die, they get pooped out. Out they go. You kill heartworms, foot-long worms. They're not going out in the poop. They're going to hang out in the vasculature until they rot, and then chunks start to come off. Yes, it's horrible to have to give a dog an arsenical compound to remove the adults, but the veterinarians are there. You guys know that that dog is potentially going to have some issues, and you can be there and ready for them to, to assist with whatever comes up. You guys aren't going to be there, and the vets aren't going to be there 2 years down the road when that worm dies and it, clogs something up, because it's still going to do the same sort of thing. So, and I know that, putting that in a shelter environment, again, is not necessarily the right context in terms of melarsamine treatment, but hopefully some of you guys are able to consider that. Okay, so prevention in shelters, it's tough, guys. I mean, how do you keep mosquitoes out? That's what you have to do. So, I don't know, screen all the windows, but then you have to also screen the runs. You need to decrease the environments in the area that have mosquitoes. So mosquito control is your goal. You're not going to get transmission from dog to dog, even through fighting. If you do it through transfusion, you're quote-unquote just moving over microfilariae. You can consider using heartworm preventive products. That would be great. And then treatment of those dogs that need it. If they are a dog that's highly adoptable, not having a huge amount of disease, and you can afford it, then treatment with melarsamine is the way to go. That's all I have.